we're throwing every resource we can to make sure that we help the people in these long-term care homes, no matter if it's transferring staff from the hospitals or bringing in the military. It's all hands on deck. And we're going to continue. We aren't going to stop.
Welcome back. That was Ontario Premier Doug Ford. COVID-19 has hit long-term care facilities across the country, hitting our elderly harder than anyone. And doctors and nurses in those facilities and in hospitals are still raising concern about whether they're getting access to the equipment they need to safely fight coronavirus. Joining me now to discuss this is the president of the Canadian Medical Association, Dr. Sandy Buchman. Doctor, thank you for joining us.
Thanks for having me.
The Canadian Medical Association has raised concerns over the past weeks about the protective equipment that doctors and nurses needed to do their jobs. Have you seen any improvement on that front?
Well, we had actually hoped that we would see improvement, but we didn't see the improvement that we had anticipated. We did an initial survey on March 30th and 31st, and the majority of doctors were very anxious that they were not having an adequate supply of PPE available. And the repeat survey on April 20th and 21st showed that things hadn't really improved overall. About 29% of physicians felt that they had a better supply, but 29% said it hadn't improved, and the rest said it had remained the same. Several doctors, up to about a third, said they only had a 1 or 2 days supply. So this still is gravely concerning.
So what kind of equipment exactly is it that they need? Is it gloves? Is it masks? Where is most of the shortage happening?
It's really the whole outfit. In around the 35% range, people reported they didn't have adequate face shields, they didn't have adequate gloves, they didn't have the N95 respirators or surgical masks, didn't have gowns. So it was really the complete outfit that they were referring to, not just the masks, for example.
Who do you think is responsible for that shortage? I mean, I know we heard this week that the federal government did not keep their personal protective equipment basically store for emergencies up to date or with as much equipment as was needed. The provinces have been accused of the same thing. I mean, who at the end of the day is responsible for the fact that there is not enough equipment for frontline healthcare workers?
Yeah, I do think that the adequate stockpiles of PPE were neglected. I mean, we had really good information post-SARS that we should be stockpiling these equipment, that it be monitored, that as equipment, long before it expired, it would be distributed to hospitals and to the community and then restocked so we wouldn't face this day. I think since the beginning of the pandemic, the government has been working incredibly hard at procuring the equipment, but we're still not really seeing it at the grassroots level. The doctors certainly aren't perceiving about when it's coming down, when they're going to get it, what's in the pipeline, how it might be distributed to those areas of the country that need it. So hard to say. I know it just goes to the point that we didn't have an adequate domestic supply available, and this is one of the things that we're learning right now for the pandemic, that we can never let happen again.
Do you have any thoughts on where we get that personal protective equipment? Because I know some have said relying on China has been a problem. A lot of the equipment coming in, over 1 million masks, were defective. Are you hearing about that from your members?
We're absolutely hearing about that. We heard about that in the survey, and I've heard that directly from our members, particularly actually in Alberta, about substandard equipment, that it was ill-fitting, that it wasn't it was old. It wasn't, the rubber bands, for example, on the masks were not good. So we're seeing that there may be substandard equipment. This is the problem. There's competition worldwide for the equipment, and we have to have equipment that meets safety standards here. We need to protect our frontline workers. They're putting themselves in harm's way, and they're anxious about that for their own health, but they're anxious that they may transmit it to their patients. They're anxious that they may bring it home to their loved ones. So it's really, really important that we have high quality equipment available and a good supply. You know, this is a marathon. You know, we've just gone through maybe the first sprint, but we're going to put the second wave and potentially the third wave. We thought flattening the curve, we'd have enough time to get even our own domestic supply manufactured in time. We were retooling many manufacturing facilities, and here we are, where we still don't really have adequate PPE, particularly at the community level.
A lot of provinces are now talking about, with the flattening of the curve, starting to reopen, looking forward to dates when they're gradually going to get back on track with the economy. Do you think that we're in a place right now, medically, in terms of COVID-19, where we're ready to start reopening the economy?
Well, we hear from our physicians, we hear from many experts that perhaps we don't have sufficient information about whether we can open safely. The survey also showed us that doctors were worried about insufficient testing, that we didn't have enough testing out in the community to really get the good data, the information that we need to be able to open safely. So there is grave concern that we're hearing about opening too soon. We understand the consequences of not opening to the economy. We understand the non-COVID problems that can develop, everything from intimate partner violence to people deferring their own medical care. So we got to get the balance, but we're really advocating for much greater testing so we can make those evidence-informed decisions.
What do you think the testing levels would have to be at before we could reopen? Would it be widespread community testing? Would it be serological testing to see if people had immunity? What are you thinking should be the benchmark here?
Well, it would be all of those things, but we're still kind of in unknown territory too. Some of the serologic testing say it demonstrates that people have antibodies. Is that true immunity? How long does it last? We're in the middle of an experiment here, a real life experiment, and it's hard to know. So our public health experts are calling for increased testing at community level and serologic testing. We're learning as we go along, but there's no doubt that that can provide information that will help guide our decisions about reopening the healthcare system and reopening the economy.
Very interesting discussion. Thank you so much for joining us, Doctor.
My pleasure. Thanks for having me.
As COVID-19 has been making workers at meatpacking plants sick, what impact is it having on operations? And is it putting our food safety at risk?